Well, with us adding the MAT and hiring so many people, that's made the whole organization better. Bringing in, I call it softer services. You bring in some addiction coaches, you bring in some LCSWs, where they're going to talk to you about things that are about your life and or how you're feeling and how you're doing. And so that brings another perspective to our practice of medicine, which is, I think, great for our practice.
Well, we have treatment team meetings twice a week. We meet with Four Rivers Behavioral Health on Tuesdays. We discuss all of our patients. Everyone is present, our counselors, I'm present, my nurse, and my scribe and the pharmacist, and we all have a part in the treatment team and the decisions. Everybody plays a role.
Not every individual that comes through here is going to be successful on their first attempt or their second attempt or their third attempt. But as a team, we all work together and we can call on other team members, our peer support individuals, because those people are in recovery, so they know where this person is coming from. Whereas I have the other side, I'm a family member and I have that piece of it. And so it's important to have all of those different aspects to present to every individual, because everybody's different and it's not the same for everybody.
The other thing that we've started doing recently is we screen universally for social determinant of health needs. And one of the questions on there is a question about alcohol or drug use affecting yourself or your family. And so if patients say yes to that, or that they would like to speak to a member of the care team, we always have our peer support specialists in to talk to the patient. And it's resulted in some distribution of Narcan. It's resulted in some people getting treatment that would likely not have sought treatment had the question not been asked and the person not been there to talk to them.
I've worked in hospitals where I've had some of that medical component, but here it's even, I guess, more collaborative even than in a hospital, if you can imagine that. The doctors will call me, they have somebody in their office that has come in for, they can't sleep or their stomach hurts, and it turns out it's more of a mental health issue. So I'll actually go down, meet with the patient while they're visiting with the doctor. We have MAT here also in the office, so if we have patients that come in with chronic pain, addiction, and that may not be what they're coming for, but our doctors recognize that, they can get that to us and we can make contact with them if they're willing.
Or if you suspect a client isn't doing as good as you think or that you want, you'll go and collaborate with the doctor or their therapist and see where you can help in their recovery. Because sometimes, like I said, some clients are ashamed to open up to you, so they may tell the therapist or their doctor something that they won't tell you. And that's how you can go about creating the relationship with them.
It's really important to collaborate, I feel like, with their counselors, because sometimes they're going to tell their counselors things like she said that they're not going to tell you, or vice versa. Just depends on the client. So it's really important that you have a relationship with the client's counselor as well, and you're able to talk about those things.
We do have other therapists here. We have case managers, we have targeted case managers, we have nurses, MAs, doctors, we have our peer support specialists. And our peer support specialists are people that have been in long-term recovery, and we typically like to have them in our group setting as well. They're a huge presence in our intensive outpatient program. They actually sit in with me when I do my IOP. I do a rotation, so like the first hour I'll have one of the peers come in, the second hour I'll have another peer come in, and then the last hour I'll have a different peer come in. So they get, to see like who they might connect with.
Peer support always sees them first before I see them, so that kind of helps to find out where they were over the last week, 2 weeks, month, however long their last visit was. And they really keep track of them through the week. And they tell the peer support folks a whole lot more than they tell me. And so he can sometimes, or she can sometimes, come in and be a liaison and come in that visit with me and say, hey, he's talked to me about this problem and this issue that he was really nervous about talking to you about. And so they really kind of helped, they'll build that trust with that person. And so sometimes they're a bridge to help me to understand the full situation of what's going on with them.
I'm really lucky in the clinic that we work for that you know, everybody, we are a team. Everywhere from the doctors to the nurses to the behavioral health coordinator to the front office people. If they have a question or if I have a question that I don't understand, we know what team members to go to get our questions answered, and we're really free on sharing information and sharing knowledge and being able to work together as a team to be able to meet the patient's needs.